This video provides information about a genetic test called exome sequencing, also called whole exome sequencing. Your doctor has suggested this test to look for a cause for your or your child's health concerns. This video will cover what exome sequencing is, what results you can expect from this test, and what decisions you need to make about testing. You will be able to discuss this information with your genetic counselor or doctor to help make a decision that is right for you. In the past, genetic testing was done one gene at a time. Exome sequencing is a test that can analyze thousands of genes all at the same time. So, with exome sequencing, we can look at more information and faster than most other types of genetic tests. So what are genes? Genes are the instructions that tell your body how to develop and function. Like a recipe gives instructions for how to make cookies, or a blueprint gives instructions for how to build a house. You have 2 copies of almost every gene. One copy comes from the egg, and one copy from the sperm that formed you. You can imagine your genetic information as a large library. You have around 20,000 genes, or books, in your genetic library. With exome sequencing, we only read through the books that we understand the best in this library. All these books together are called the exome. This is where the test gets its name. We look at the exome because it contains genes that we know are important for health and development. With exome sequencing, we are reading through many genes, similar to reading through many books in a library. We read through each book to see if there are any misspelled, extra, or missing words that cause the book to not be understood. In the same way, we read through each gene to see if there are any differences that may disrupt the gene and cause health concerns. We call these differences variants. Exome sequencing is most commonly done on a blood or saliva sample. To help understand the results, family members such as the parents may also be asked to provide a sample. Exome sequencing can give 3 types of results: positive, negative, or uncertain. A positive result means a genetic cause is found for you or your child's health concerns. Sometimes, knowing the genetic cause can lead to a specific treatment. More commonly, a positive result does not change how your doctor looks after you or your child. In most cases, it will also tell you how the condition may be passed down in the family. A second possibility is that the test does not find anything. This is called a negative or an uninformative result. Remember, exome sequencing only looks through the books or genes we understand the best in the library. So it is possible that some genetic causes are not found by exome sequencing. The third possibility is an uncertain result. This means a genetic variant was found that is not well understood. It may or may not explain the health concerns. Your doctor or genetic counselor will discuss with you possible next steps to try to better understand this result. It is important to know that exome sequencing has limitations. That is, there are some genetic variants that are not found by this test. Although our understanding of genetics is growing every day, there are limitations to what we know at this time. If you decide to have exome sequencing, you also have the option to learn about secondary findings. Secondary findings are a separate report where a select set of genes are examined. These genes are not related to the main reason exome sequencing is being offered. Problems in one of these genes may increase the chances of developing certain health concerns in the future. For example, secondary findings may show that you or your child has a higher chance of certain types of inherited cancer or inherited heart problems. While these are rare conditions, They can have important impacts on your health, and recommendations for your medical care may change. Some examples can include taking a new medication, having regular screening, or in some cases, surgery. There are two decisions to make. The first decision is whether or not to have exome sequencing. Remember, exome sequencing is offered to try to find an explanation for your or your child's current health concerns. The second decision is about secondary findings. They can tell you about the chances of certain health concerns that may develop in the future. Secondary findings are optional. You do not need to say yes to secondary findings to have the exome test done. To help you decide about secondary findings, consider, is this information you would want to know? People can have many different reactions when they learn about health concerns that may develop later on. How would this be for you? It is important to know that not everyone who has a secondary finding will actually develop health concerns. The result will not tell you if you will develop symptoms or at what age. When a secondary finding is seen, your doctor will talk to you about recommended next steps. Every person who has exome sequencing needs to choose if they want to learn about secondary findings. For example, a parent will decide if they wish to know secondary findings for themselves and their child. Secondary findings will only be included on your report with your consent.